By popular demand, let's talk about LDN. What is LDN, or low-dose naltrexone? It's an off-label use as a novel anti-inflammatory of a drug called naltrexone. Naltrexone is an opioid antagonist, meaning it blocks opioid receptors in the brain. At high doses like 50 milligrams, it's used for those with substance use disorders to prevent them from getting a high if they were to use a substance. At small doses of typically 0.5 to 4.5 milligrams, it's used as, again, a novel anti-inflammatory. So how does it work? At very low doses, it blocks the opioid receptors and it tricks your brain into thinking it needs to make more natural opioids or endorphins. This has a very anti-inflammatory effect on the brain, and so many people, myself included, have found benefit in this for inflammation, migraine, pppd, dizziness. Other uses I've seen for it are typically things like autoimmunity, chronic pain, anything with an inflammatory component. This is a medication typically prescribed by functional doctors that needs to be sent to a compounding pharmacy.